Hello guys, welcome to the Charis Pharmacology. In today's video, we are going to be talking about dose response curve. We are going to be looking at potency, efficacy, therapeutic index. Now, we all know from our basic pharmacology, pharmacodynamics, what the drug does to the body. That for a drug to work, let's say this is the drug, it have to bind to certain receptors on the cell surface. Certain receptors on the cell surface. Now, when we talk about dose response curve, we are looking at the dose of a drug that is required to elicit a given pharmacological response or effect. Dose response curve can also be called concentration effect curve. Concentration as in experimental studies and effect as in giving pharmacological effect. But when we are talking about real life pharmacological clinical trials, we are looking at dose response. We are looking at the dose of the drug and the response. Why for experimental studies, in the lab, we are looking at concentration and effect. So we are going to be looking at potency. So let's say I have my graph here. Y-axis, I have my effect, or let me use response rather, since it's dose response. I have my response in percentage. You can plot it in percentage. So let's say I have 10% here, I have 50% here, and I have a full 100% response here. And for my x-axis, I have my dose of drug here. Now, if I'm going to plot this graph, in the normal dose response curve, it's going to give me a rectangular hyperbola shape. It's going to give me a rectangular hyperbola. Let's say I'm giving 10 milligram of acetaminophen, paracetamol, and I start giving 10 milligram here, right? 10 milligram of paracetamol. I increase my dose to 20 milligram. So I have 20 milligram here. The different response produced by these drugs. So if I increase my dose, there'll be a time whereby I'll reach the particular dose where the drug at the receptor site will be fully saturated. So this particular dose, let's call it Z, right? It will be fully saturated. So here we can see that when I give my drugs, I give 5 milligram, I give 4 milligram, there's no noticeable change, or there's no noticeable response or effect. It will get to a point whereby it will reach a threshold where the response will begin to come out obvious. The response will be noticeable. So this particular threshold, from there it will go on a steep slope. It will increase, and it will plateau. So it will plateau. I hope I'm spelling this right. It will plateau at the 100% maximal effect when the drug at the receptor site is fully saturated. So that is why we have this plateau. Any additional dose would not cause any increase in response or effects. So if we're looking at this graph, this is a rectangular hyperbola graph, and it's quite a simplified diagram. But in pharmacology, we normally use the logarithmic dose response curve. So if we're going to plot this particular graph, this particular dose in logarithmic term, I'm going to start administering a particular dose of paracetamol, for example. There will be no noticeable response or no noticeable effect seen. There will be a particular dose whereby it will reach its threshold level. There will be a noticeable response or effect, and it will begin to increase. It will begin to increase until it reaches the full maximal. Let me bring this down. Its full maximal effect. Remember the same thing for the um, full maximal response or effect. The same thing for the rectangular hyperbola, right? So now if you look at this, here we can see that at 10 raised to power minus 2 concentration or dose of the drug, there is no noticeable response. Increasing the dose or increasing the concentration of the drug at the receptor sites, when we give the drug, there is a noticeable response and there is a steep slope. This steep slope corresponds to an increase in dose lead to a corresponding rise in response of the drug. There will be a particular point again whereby the let me use this point, this particular starting point. There will be a particular point again whereby you are going to give the dose of the drug and the receptor site is going to be fully saturated. And of course, there is no increase in response or no increase in pharmacological effect. There's no change. So at this particular point, the curve again forms a plateau or remains no change. At this point, increasing the drug or increasing the dosage of the drug at the receptor side causes no noticeable response, causes no rise in response, and can also lead to toxicity. So let's talk about potency. I say potency is the ability of a drug or is the amount of the drug that can cause a specific effect. So now there is something I want you to know so that it can be very easy for you when you're giving a dose response curve to determine which is more potent, which is less potent. Know that the more the drug binds to the receptor, that means the ability of the drug to bind tightly to a receptor, that is called drug affinity. So the higher the drug affinity, right? The higher the drug affinity, the higher the potency of a drug. Drug affinity is correlational to potency because the more the drug binds to that particular receptor, the more tightly this drug binds to that particular receptor, the higher the potency. That means we would need a low dose of drug to produce a given response. The lower the affinity of the drug, the lower the potency. That means the drug is less potent because the drug is less, the receptor affinity or the drug affinity at the receptor side is very low. So when we are using the dose response curve to explain potency, here we are looking at the dose of the drug that can cause a response in 50% of the population, or the effective dose. We call it ED50 for effective dose of the drug. Effective dose of drug to produce a given response. It can also be called EC50, which is the effective concentration. Effective concentration of drug at the receptor site. So at this particular place, there is 50% response of the drug. The dose of the drug that can produce 50% response or 50% pharmacological effect is referred to as EC50. The EC50, we look at this when working with potency because I said potency is the concentration or the dose of the drug required to produce an effective or therapeutic dose in 50% of the population. So now, if I have two drugs at different concentration, let me expand this a little. Let me expand this. So I have, of course, my dose in logarithm, dose of drugs in logarithm. If I expand this a little, I can see that, let's say this is for dose A, and I have another sigmoid curve at different concentration for dose that will still produce the same 50% of the population, 50% response in a given population. For dose B. If you look at these two sigmoid curve of, let's say two drugs or even the same drug, we can see that at dose A, we would require a lower dose to produce an effective or therapeutic effect in 50% of the population. We require a lower dose to produce an effective response, that is EC50, in 50% of the population. So EC50 or ED50, because I'm dealing with dose response now, so I'm going to change this C to D. ED50, it is the dose of the drug that is required to produce 50% therapeutic response or 50% response in a given population. So here we can see that we need a lower dose to produce 50%, but at concentration B, we need a higher dose to produce that same 50% response in a given population. So which of this drug can you deduce is more potent? I say potency is the amount or concentration of the drug required to produce a given response, a given effective response. So of course, A is more potent than B. So sigmoid curve A is more potent than sigmoid curve B. This shows us something, that the potency of a drug increases to the right of the curve, to the right side of the curve. The potency of the drug increased to the right side of the curve because here we have lower dose that will still produce the same 50% response in a given population. Efficacy of a drug just have to do with the full the ability of the drug to produce a full maximal response. Some drugs are more efficacious than others. Some drugs are sub-efficacious. And depending on the type of drug, some drugs are like full agonists. We know that a full agonist maximally potentiate or stimulate a receptor, producing 100%, efficacy, while a partial agonist partially or do not completely stimulate or potentiate a receptor, the effect of the drug on the receptor, and it is that is less than 100% efficacy, sub-efficacious. So this produce a full maximal effect. This produce a sub-maximal effect, and we can see that in our dose response curve. Let's say this is S, and this is for the full agonist. This is for the partial agonist, S. This is for the partial agonist, and I said at the maximum response, which is at 100%, this is my response or my effect. This is my dose or my concentration of the drug. So here we can see that at full um, at the saturated receptor sites, a full agonist will produce a maximal effect or a maximal response, while a partial agonist will produce a sub-maximal response. Then we can deduce that efficacy increases upward and of course decrease downward. From what you can see is for, let's say this is 100%, that is full efficacy, and this is, let's say this is 90, or let's say 80%, that is sub-efficacious for partial agonists. And there are some drugs that have very low efficacy. Let's say this is 25%, very low efficacy, lower efficacy. Of course, this is now high efficacy. So that is all for efficacy and potency. Some drugs like morphine or codeine, one is more efficacious than the other. One is more potent than the other. So potency and efficacy in dose response curve is very important. Let's say I give you a question like this. And I said for drug A, I have this. For drug B, I have this. For drug C, I have this, and I have this for drug D. So this is my response or my effect, and I have 100%, I have 50%, and let's say I have here 10%. And this is my dose in logarithm. Remember, the sigmoid curve is logometric, is a logometric curve. So I have, this is drug A, drug B, drug C, drug D. If I'm going to ask you which of those drug is more potent, we know that potency of the drug increases when the drug shifts to the right of the curve. That means we require a lower dose for 50% response. So I'm going to trace my 50% to all this curve, and I'm going to see what are their doses. So this is for dose A, dose B, dose C, dose D. So drug A is more potent than any of the drug listed here. The next one that is more potent is, of course, drug B, more potent. And drug C is also potent. The one that is least potent because it requires a very high concentration to produce the same 50% response in a given population. So drug D is least potent. If I ask again, which of these drugs is more efficacious? Now we can see that drug A, B, and C have the same efficacy. They have the same efficacy. So drug A, B, and C, A is equals to B is equals to C is equals to same efficacy. They are equally efficacious, same efficacy. Why for drug D, we have a a lower response or a lower effect, so it's submaximal. So drug D is the least efficacious, has the least efficacy. Remember, response is sideways, efficacy is up and down. And that is all for potency and efficacy. Let's talk about therapeutic index. Very important concept in pharmacology and toxicology. Therapeutic index, or the therapeutic, what will I call it again? Therapeutic ratio, therapeutic index, any I want to call it. So let's say I have a graph. I have this particular drug at this concentration, let's say 50%, 100%. I have another sigmoid curve at this particular concentration. Let's say at this concentration A, concentration B, and of course my concentration is a logarithm. This is my response. EC or ED50, I'm dealing with those. Now, therapeutic index or therapeutic ratio is the ratio of the toxic dose, ED50, to the effective dose, TD50 to ED50. If you're dealing with concentration, we have TC50 to EC50, toxic concentration to effective concentration. So now, if I look at this particular graph, I can see that at dose A, at a lower dose, which is more potent in this sigmoid curve, at dose A, I have ED50, the concentration of a drug that can produce a therapeutic or beneficial response in 50% of the population. At dose B, I have a higher dose. And what does higher dose means? The higher the dose, the higher the toxicity, right? Sounds familiar. At dose B, I have a higher dose that will still produce a given response in 50% of this population. I call this higher dose TD50 or TC50, toxic dose, toxic dose that can produce toxic or lethal effect at 50% of the population. As you can see, we have ED50 and TD50. So the ratio between ED50 and TD50 gives us our therapeutic index or therapeutic ratio formula. If the therapeutic index TI is closer to is equal to 1, that means that particular drug is very dangerous, is very toxic. For drug dose A to drug dose B, it is farther apart. This is called the therapeutic window or the therapeutic margin. How far is ED50 from TD50? Most drugs have a narrow therapeutic window or a narrow therapeutic margin. An example of a drug is warfarin. Warfarin curve is like this. The difference or the margin between the ED50 and LD50 is very narrow. That means if I'm administering a drug to be potent, to cause a desired response in 50% of the population, and I continue increasing that dose, it will not take me long before I reach the toxic dose that can produce a lethal effect. That's why if you are dealing with warfarin and other drugs that are warfarin, lithium, cyclosporine, aminoglycoside, these drugs have a narrow therapeutic window, so they require monitoring because it will be very fast for you to reach the toxic dose. They have a narrow therapeutic margin, a narrow therapeutic range, or a narrow therapeutic window. But if you have a drug like, let's say, some safe antibiotics, that it will take you, and it will take you a very long time to reach a toxic dose. You have to have an overdose to reach a toxic dose. Then we say that this particular drug have, a high therapeutic index, or it has a normal therapeutic index, and it is safe to use. But drugs with narrow therapeutic window or narrow therapeutic ratio requires monitoring because it's very easy for the administration of the drug to reach its toxic dose in the bloodstream or in the blood plasma. And that is all for those response curve. We have talked about potency, efficacy, and therapeutic index.